EGM Network.
Good afternoon, and welcome to Community Conversations. So nice to have you dialed into our show again this week, because as you know, every week we have someone different. I looked back at some documents earlier this week, and we used to call ourselves healthy communities. But the reality is that while we always have a health focus, a lot of collaboration has taken place over the last 5 years, especially among all the nonprofits. And so community conversations is much more relevant, I think, than just hearing constantly about health. Okay. So having said that, I do have someone who is vested in health this week. Bonnie, welcome.
Thank you.
Yes.
Thank you so much for having me here.
So you are representing
CareNet Pregnancy Center of Indian River County. So we always add Indian River County because there are different CareNets across the county, across the country, rather. There is Treasure Coast CareNet down in Port St. Lucie.
And so is that similar to the federally qualified health centers? The interest is the same, but you're all locally run within your own city or town?
Yes, we're all autonomous, and there's about 1,200 different affiliated pregnancy centers with CareNet National, which they are in Virginia. And so we're all affiliated with them, and we go along with their core values, but we pay an affiliation fee, and then we receive lots of great training from them.
So that is a very similar model. The membership really helps. You don't have to reinvent the wheel on everything. And most importantly, you find out how other leaders are successfully running their organization efficiently and with great patient satisfaction.
Yeah, I have other executive directors that I collaborate with discussing different things, and we share ideas and
that's wonderful.
Woes and happy things.
I can relate.
Everything. So, it's
so
great.
You guys have been in existence here in this county for a very long time.
Yes, since 1984.
That's amazing.
We came to Vero Beach, and we've been here for 41 years. Part of those 41 years, we were hidden in this little 70-year-old house over by Pocahontas Park. Back when they purchased that building, girls didn't want anyone to see that they were pregnant. So they wanted to, be secluded and hidden. But then as time has gone on, we just grew out of that building quite quickly. And it was almost comical the last few months we were there where we were thinking we have got to get out of here fast. I had 3 people in my office just sharing my office.
Wow.
That's how crowded we were.
Yeah.
And one time we had so many people in the lobby. Then the mailman came and he's trying to hand me something and I'm trying to reach over the children and the strollers and everything.
Yeah.
So, but now we have this beautiful 5,000 square foot building just 2 blocks south or west of the hospital, in the medical specialties building.
So right on the bus route.
Yes, there is a bus route right there. I'm not on our property, but right next door.
Okay.
And so we share that condo unit with 4 other medical facilities. And it has been a wonderful blessing. So great. It's easy for people to get to. We actually have 41 parking spots versus 12.
Wow.
We had 12 at the other place to fit. But so it's been, and it's set up perfectly for everything that we do.
Okay. So similar to our federally qualified health centers, where everyone hears the federal and thinks that we're completely supported by the federal government, which is nothing like it is in reality. We actually receive about 15% of our funding from them, which is not an insignificant amount, but everything else either has to come through patients or donors. I suspect that you're in exactly the same situation.
Yes. And as a matter of fact, we don't receive any government funding. All of our funding comes from people in Indian River County, from businesses, from churches, individuals, and grants.
See, there's where we differ. You take church money and we don't. So church, state, whatever. It's probably about the same. But definitely supported by the likes of our community.
Yes.
And so 41 years is even longer than Treasure Coast Community Health.
And we're having our 41st annual banquet on November 14th. So if anyone listening to this would like to come and hear more about CareNet Pregnancy Center, it's going to be a great evening.
Where's it going to be? What's the time? What's the charge?
It's $100 per person. It is at the IG Center, and it starts at 6 o'clock, and they can go to carenetchampions.org to register.
Okay.
Or they can call 772-569-7939 to talk to someone about registering. But it's going to be a lovely evening with a beautiful dinner and some nice little surprises.
Oh, sounds very nice. So tell us about the services that you offer. Like us, you've probably evolved over time to meet more of the needs. So tell us about those.
Yes. Okay. So we serve women and men from the time they find out they're pregnant until their child is even up to 4 years old, because we just have extended that through the years because we have seen such a need. And many people think that because we're a pregnancy center, we only see them while they're pregnant, these moms. But we all know, if you've had a child, that life gets harder after you have the baby.
Sure does.
And so we have all these wonderful videos. So first of all, they come in for a medical grade pregnancy test and an ultrasound by an RDMS, which is a registered diagnostic medical sonographer. And Dr. Presley, who has delivered over 4,000 babies in Indian River County, he is our medical director. He oversees all of our ultrasound scans and our whole medical program. He's also on our board. He is fabulous to work with. And he's
just a great guy.
He is
Everybody
a great guy.
loves him.
Yes. We're blessed to have him.
So when people find out they're pregnant, there is the Partners in Women's Health program, but some folks are finding it more difficult to get in there.
Yes. And so, and we want to do everything we can to help them get OB care as soon as possible. So yes, we refer them to partners, but also we have a list of others. And sometimes we receive, people come from St. Lucie County or even Broward County. Is that Broward or Brevard?
Brevard is north. Broward is south.
Okay. Brevard.
Yeah.
Brevard. So we have
resources.
OBs,
Okay.
And then also some want midwives and
natural home births.
Yes, it all.
I know. For those of us that didn't grow up in that area, it's hard to spit it out. But
it's all of that.
Yeah.
So we want to encourage that. And we also, everything that we do at CareNet, our moms and dads get points because we have this amazing baby boutique that they can go shopping at. So in the medical department's program, and then when they move on to see our client advocates as they're moving on with their pregnancy and after they've had their baby, we watch their OB appointments and they get points for
attending?
Yes. And so we are encouraging make those appointments. And we also receive women that have had no OB care. I remember a few years back, this precious teenager came in at 20 weeks pregnant. We, got her connected to an OB doctor, and then we saw her at 40 weeks. She came in the day before Thanksgiving, so it's almost been 3 years now. And she had never gone to OB care. So Dr. Presley said, send her to the emergency room. And so she had the baby the next day on Thanksgiving.
How wonderful.
Yeah, and a beautiful, thank the Lord, healthy 8-pound baby girl. But, so we do encourage them to go. And then even people can come if they have a 1.5-year-old and they just find out about CareNet because our services go so much further. So it's really a benefit because diapers and all of that are expensive. So far, I think this year we've had 70 babies born. And so all of our babies the mothers receive an new infant car seat that's suitable to bring their baby home from the hospital.
Nice.
I know there's some car seats that aren't suitable, but these are. And then they receive a new crib and a mattress. And then also we give out 80 diapers a month to every one of our moms. Last year we gave out almost 79,000 diapers.
Whoa!
Our baby boutique manager, she counts every one. It was 78,499 diapers. So
these are all free, based on the donations you receive from the community.
Yes.
What a blessing!
Oh, it is a blessing. And with especially the diapers, that came from a wonderful grant we received from a woman that has helped us do that. So we're so grateful for that.
Yeah, it just boggles my mind.
Yeah.
Maybe we should have postpartum points for coming in to Treasure Coast because a lot of the gals have babies fairly close together.
Mm-hmm.
And so they don't necessarily build their body back up. And we'll talk more.
Yeah.
Sorry. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Welcome to Riverside Theater's Comedy Zone, where the comedy is wild, untamed, and downright hilarious. Hit the zone this Friday and Saturday night at 6:30 and 8:30 for the Treasure Coast Best Live Stand-Up Comedy Show, featuring nationally recognized comedians with cabaret-style seating and food and drink table service. Buy tickets at riversidetheater.com and get ready for a night of non-stop laughs.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats, and chairs in the latest styles and colors from Tommy Bahama, Lexington, Hooker, Four Seasons, Braxton, Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of American-made Telescope, Berlin Gardens, Lloyd Flanders, and Pollywood, all with no tariff ever. And we also specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a huge floor sample sale with lots of great markdowns on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. And visit our website at sunshinefurniturecasual.com.
And welcome back to Community Conversations. My name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health. And I've been there for a good long time, as you might have guessed if you were on the first segment where I talked about looking back through documents and how this radio show used to go under a different name. I've been doing this because it is so interesting to me to be able to spend some concentrated time with different leaders around the community, hearing about the things that they're doing, how we might overlap, how we can help support each other and increase the overall health, whether it's economic or physical health, mental health. There's all kinds of different health things, and today is no exception. We reached out to Bonnie Martinelli, who is from
CareNet Pregnancy Center of Indian River County.
I always want to make sure that I don't blurp on the name. So thank you, Bonnie.
You're welcome.
So we've been talking about the fact that your organization is 41 years young. It has evolved over time as social norms and other things have changed. But you are still a very donor dependent organization. And so you do have fundraising events, and you've got one coming up soon.
Yes.
So tell us again about that.
Yes, 2 weeks from tomorrow, November 14th at 6 o'clock at the IG Center. And you can get tickets at carenetchampions.org or 772-569-7939. It's going to be a lovely evening. The tickets are $100, I think. That I said that already. But
Okay.
we're going to have a wonderful dinner and speaker
And so a lot of the things that, well, all the services you provide are free.
Yeah.
So folks are very economically oriented these days with good cause, with food insecurity and, you know, a scarcity of resources themselves to give to others. the question I get is, well, how many of your staff are volunteers and how many are paid?
That's a great question. So we have 10 staff and then at least 50 volunteers a week. So we rely heavily on our volunteers and we train them for months, and they are just, I mean, right now as we speak, there's a group of ladies getting things ready for the banquet, a group of ladies actually putting up our Christmas tree. They wanted to do it early, and we have a gorgeous tree. I'm like, okay. Okay. So, and then we open today on Thursdays. We're open until 8 o'clock at night. So, so we are.
So working couples can come in later after work.
Yes.
Wonderful.
Yeah, and we have a fatherhood program, and we know a lot of the men are working and a lot of the women are working. And so they can come in after work. And Thursday nights are usually very busy. We've considered opening late another night to make it easier for people. And yes, all of our services are free. Most of the time people are shocked that they're all free and there's no form to fill out. So it doesn't matter if you are a homeless, pregnant mom, couch surfing, and you need help versus someone that's happily married, excited about this baby, and is fine financially. Everyone needs help in some way, shape, or form. And so that's what we want to give to them. And we have several wonderful ladies that have been professionals and now volunteer their time. We have Mary Becker, who's a lactation consultant, and she's done this for 45 years. She works with all of our mothers one-on-one or in group settings. She'll even let these mothers text her from 8 a.m. to 8 p.m. with questions, and then she'll call them back. And so we really encourage moms to do that. And then we also have Erin Heyer, which is a speech language pathologist, who had her own practice for 35 years, now volunteers at CareNet. And it's everything you can imagine she talks to these moms about. And I even listen to her because I have
language.
Yeah, and I have my grandchildren that live with me. So 2
okay.
and 4 years old. So I gleaned from her. Yes. And so it doesn't matter. You can join CareNet at any time. You don't have to join us while you're pregnant. You can have your baby can be 2 or want to come to this class at 3. So, and like I said, we have the baby boutique that we give points for everything they do. And then another class we started this year is our maternal grief class, because 1 in 4 pregnancies end in miscarriage or stillbirth.
High?
It is that high.
Oh my goodness.
Yep. And we almost weekly get a phone call about a miscarriage or a stillbirth. And that can be from anyone also. Next week we have someone coming in that just went through a miscarriage, and the 2 ladies that serve in this program, one is a hospice nurse, and she has her own grief counseling business.
Oh,
and
wonderful.
Another one is a woman that had a stillbirth at 38 weeks. So these 2 women are great helping these women.
They've walked through this experience themselves.
Yes, or they've helped many other people. So it's helpful.
That's a wonderful resource because it's such a private affair, and yet it's so heart-stopping that you can't function easily.
Right.
Yeah.
Because, like you said, it is a private affair. Many times women don't share that they're pregnant until the second semester, because just in case they have that miscarriage. But what's sad is if they do have the miscarriage, then they're isolated and they're alone and they're mourning. Their body is still going through all these hormones, and yet they don't have their baby. So it is sad.
Well, thank you for sharing that resource, because that is huge. I know that the VNA has a grief support, but typically I think the group is more about older folks, sometimes children, cancer-stricken and that sort of thing. But as you say, that's a completely different situation because you don't have those shared memories, pictures, etc., that you do when you have a miscarriage. So thank you so much.
You're
it's good to
welcome.
know.
Yeah.
So can I peel back to something you said earlier about the Fathers Group? What is that like? What do they do? What do they get education on? Or I know guys are reluctant,
Yes.
dragging them in sometimes. There's a few exceptions.
Right.
Tell us how you get them in and what they talk about or what they do.
So usually they come in when they're partner or wife is pregnant.
Okay.
We just recently, we had two 16-year-old young men come in.
Well,
And
kudos to them
yes,
for coming in.
Yes.
But 16.
Yeah,
Oh, my goodness.
yeah. One was very large. One was so young looking. But anyway, we are so happy to have fatherhood coaches to mentor them. And so we have 6 fatherhood coaches that will sit one-on-one and talk with them about becoming a father. And then some of those videos that we have are actually for the dads to tell them what's going on in her body while she's pregnant. So they can understand all these changes going on in her body, her emotions, ways to support her through her pregnancy. And then what
you don't learn that in high school.
No, you don't. You don't. And then also what to expect when they have the baby. And Mary, our breastfeeding consultant, she really, suggests that the men, learn too, because she said, when a woman has a baby, so much is going on and she forgets a lot of things that she has learned. So having a second brain is what Mary says is so helpful. And so we encourage them to come in because we let them know at the moment of conception, her 23 chromosomes, his 23 come together and there's a spark of life, literally, scientifically. And we say, Dad, because of your Y chromosome, you determined the gender of the baby. So you're a dad now, not when the baby's born. So and that's what the mother wants more than anything.
That support.
His support.
Absolutely.
And then when she sees all that we can provide for her financially in the boutique, plus we have a resource book about that thick of all the amazing places that we can refer them to, like TCCH and just
affordable places again, because most of us drift through life picking up things that are pertinent to our life at that time. But if you haven't been pregnant, if you're not expecting the pregnancy, you probably have passed by a number of these community resources a dozen times or more and don't realize it until someone says, well, go over on this street, make that turn. There's a big building. Oh my gosh, that's right. I didn't even realize that.
That is so true. I've lived in Vero Beach for years and years, and until I started working at CareNet in 2019, I had no idea what we offer
that's normal.
here.
Yeah, that's normal. But it's good to know that there's that reference out there.
Yeah.
So you work through a number of churches, community groups as well.
Yes.
And how does that work? How do they understand your services then, if you don't mind my asking?
Yeah, no, not at all. So sitting in the pews are people that we can help. And so, pastors have a huge job. They can't handle all the things and the questions and that they have to go through, and the youth leaders. So we also have a student services program. We just our student services director just went to go work at her church with her husband. So we are looking for a new student services director. But we want to help youth pastors. We also partner with First Priority, which goes into the schools as a club. They invited us to join them. And then we want to help tweens and teens understand their bodies. Many times they don't know what's going on with their bodies and with their mother. So we offer these type of classes too.
So we're almost out of time. I don't want to ignore the contact information. So you've got a website for interested parties.
Yes. So we have for clients and patients, we have carenetirc.org. And then for those that are interested in donating or hearing more, volunteering, it's carenetchampions.org.
Okay. And is there a phone number if they wanted to call you?
Yes, 772-539-1. Oh, that's my number.
Yeah.
Skip that.
We'll skip
Although
that.
I'll take any call. But the number is 772-569-7939.
That's wonderful, Bonnie. Thank you so much for being here today and sharing all the great things that you do. You really make a difference in our community. And thank you all for being here to the end, and share this information or call Bonnie if you have other questions.
Yes.
And have a great evening. Take care now.